It's Thursday, May 15th. I'm Adam Walsh, and this is The Signal. We live in a time of record drug overdoses in this province. And on this show, we've heard about the reality of drug use, the availability. We've talked about harm reduction. Today, we talk sustainable recovery, what it takes to get there, what works, and what is needed afterwards. And my guests here in studio. So we've got three guests in studio, and we've got a couple calls to make. But my guests are all from Vida Nova, the province's newest addiction center. Ryan Kirby is here, co-owner of Vida Nova Recovery. How you doing?
I'm doing great, thanks.
Thanks for coming in.
I really appreciate it.
We've got Melissa Wells, managing director, new, right? When was the official start date?
I started April 1st,
Okay.
so I've been working with the team now for a little bit.
Yeah. So what was that like to, you come in, right? You're not coming into a spot that's established. You're part of the OG unit to get this thing started. What was it like for day one and like all the planning that you're doing?
You actually hit the nail on the head because, I tell people you usually start a job and you're orientated by somebody into how the role is going to go, but here we are creating the role. So it was certainly, it was a challenge. I knew it was going to be a challenge, but I'm so happy that I accepted that challenge.
And a bit of background on you. Is it, so you're a nurse, and what else, tell us just a little slice of you and your background for this job.
So I'm a registered nurse. The majority of my career has been worked in mental health and addictions as a frontline nurse. And I moved into a management position in mental health and addictions, and then throughout the health authority in other management roles, and most recently as provincial leader. And as soon as I heard of this opportunity, I knew that it was the one for me to bring me back to my passion in mental health and addictions.
All right. And we've got Dr. Anthony Parrell here as well, medical director. How you doing?
Oh, excellent. Thank you so much for having us.
So were you an April 1st start day too, or when was your first day?
So I've been working with the team for a little while now, but my official start date would have been when we put out the notice of our joining the team.
Right on. Why for you?
So for me, I'm very passionate about this project. I think it's a new adjunct and something that can help support what we already have in the province to help advance addiction care. So I'm a born and raised Newfoundlander, went here for med school, and then went away to U of T for residency. And then I did extra training during my residency during the Sunnybrook Addictions team, methadone, Suboxone clinics, RAM clinics. And I also did extra training and work in Emerge. And throughout that whole process, I saw, full spectrum, the need for addictions care and what's going on across the country. And then this year I came back home and I wanted to bring what I learned there to help my fellow Newfoundlander.
So a doctor who went up along and came back home.
Yeah.
Okay, that's notable. This conversation, very notable, but also overall, with the shortage of doctors we have here, it's nice to see folks coming back. Here's the question. Either of you can jump in on it. If you're living with substance use disorder, right? So we've done shows in the past. We've talked about cocaine overdoses, right? The availability here, fentanyl, right? There was just a bust the other week around Cochrane Pond. We've talked about alcohol and its impacts in this province. So if you're someone who is maybe thinking about seeking treatment, what's the window like for that? Like how because it's not I want treatment and maybe today it works for me, but it may not necessarily be tomorrow or the day after. Like sometimes there's just a small sliver of time. I'm just wondering if one of you can kind of weigh in on what that reality is for someone and like how long a window can be open for treatment.
So I can comment a bit on that. So I think it's very patient dependent.
Yeah.
There are some people that reach a point where they say, I'm going to seek treatment, and that's their goal and that's what they're going to pursue. But there's also people who are struggling with what they're dealing with their substance use disorder. And they might come in an overdose situation to see me in the emerge, or they might be reaching out for help and have a very small window of time before their next time where they need to use a substance to mitigate their withdrawal. And so I've seen many situations where people come in to see me in an emerge situation where, I provide all the resources and everything I can do from that perspective. And then sometimes it's thrown into the trash on the way out, unfortunately, because their window's gone.
Yeah. So what does a wait list do for when you have what you just said? What happens across the country, right? It doesn't have to be just Newfoundland and Labrador, but what happens when there are wait lists and treatment options are not available because of backlogs?
People die, unfortunately.
Yeah.
The supply of drugs now is very tampered with fentanyl and other fentanyl derivatives at doses that are very lethal. I saw the drug bust news there recently, and I was doing some math on the numbers, and I was thinking to myself, that's enough drugs to kill everyone in the province.
Yeah.
Many times over. If I get a patient who comes to see me with a fractured hip and I'm pushing fentanyl for procedural sedation or just immediate pain relief, I'm giving micrograms, and we're busting grams and grams and grams.
Yeah, micrograms compared to grams, right?
Yeah.
Okay. So in this province, right, for what we're talking about, if you are someone who wants treatment, what are your options? What's the reality for you right now in this province?
From a personal standpoint, I can say, we have 2 facilities right now on the island. We did at one point a number of years ago. We had another facility out on the West Coast. That's the facility that I personally went to myself. If I had been trying to go to the Grace or Humber at that time, I probably would have been faced with a 3 to 6 or 9 month wait list to get in somewhere.
Yeah.
So when we talk about that window that you just mentioned, I sort of look at it like it's a very small window. And when someone says, I need help, we need resources to be able to say, come with me. Right. We got you right now. And that's not something this province has been able to say. So, with Vida Nova coming online, I think that there's an opportunity there where we can cut down wait times and we can, having the detox wing in our facility gives us the ability to take someone right from the street into our building, as opposed to we don't need to say, you need to wait a week until you detox and feel comfortable enough, or we can look after you properly. We have that ability to take you right away.
Yeah, we got you, and we can from, like you said, from detox to everything that's going to follow that, we can start this process, and it can be this is a forever, if all goes well. It's the
far
forever
beyond when you leave our
process,
building,
exactly.
100%, right? I mean, I think the aftercare, which, it's another topic, but it's such a huge piece of this. It's not just, your 28 days in programming in a facility and then a piece of paper with a couple of resources on it.
No.
You're attending meetings every week. You're meeting with counselors. And, you're being looked after, and we're following you for
The full range, right?
Yeah, for sure.
Everything. I was looking through some of the stuff, the info you folks have, and empathy is a word that gets used often. The care is folks who are empathic, who are looking at people as humans, person to person, and that's so important.
So important.
In a world with stigma around drug use and addictions, to have someone who you feel cares and hears you is massively, massively important.
100%, and especially when we talk about lived experience and when you can look at someone and know that they've been where you are, and to have that, and that's something that Vida Nova we're looking at doing, and bringing lived experience into the building where we can. For myself personally, where I was, the facility had lived experience in there. So when I did, one-on-one counseling or group counseling and different things, there is this feeling of being heard and understood.
Peer to peer is huge, right? Like to know that someone will have some idea of what you have gone through, are going through, and will go through.
100%, and that's not saying that the professionals who didn't go through it are not able to help, because they certainly are. They have that clinical side and all that knowledge to be able to. But there is something special about being able to really look at that person across from you and just know that they know. They've been there.
And that speaks to a fulsome approach, right? It's like, well, we've got the medical professionals on one side of this, plus we've got this peer-to-peer and these types of discussions. Like all of that together, you can start to see like, okay, any little gaps, like why it's so important to have all of that as one fulsome bit of help for folks, right?
Right, yeah.
We will continue to unpack exactly what, like some of the backstory and where things are going to be going with Vida Nova. I want, and so this is specific to one spot in Newfoundland and Labrador that's about to open, but it's about the province and also about the country. And for a wider view, on the line joining us, we've got Linda Bell, who co-founded and served as Chief Executive Officer at Bellwood Services Inc. Linda, thank you for joining us on the show.
Happy to be here, Adam.
Explain, if I think some people will know about Bellwood, but just give us a bit of an explainer on it and like its history, and then we'll go from there.
Well, the history goes back a long way. The history goes back to the Second World War because my father was a physician in the Canadian military, and he dealt with people with what they call post-traumatic stress disorder. We called it shell shock back then. But when the war was over, he had permission from the Ministry of Health in Ontario to open our home to 4 patients before he had to have a hospital license. And so the people who arrived were people with a drinking problem. And their other options were to either go to jail or to go to locked psychiatric hospitals. And since that time, he opened a variety of different treatment centers. And in 1967, which is 58 years ago, he opened the first public hospital for addiction in Canada. Sorry.
That's okay.
And what's so interesting when you talk about stigma, when that hospital was built here in Toronto, every patient was given their own room, specifically because we wanted them to feel good about themselves because they had been very rejected, very stigmatized. And we've made some progress, but we haven't made tremendous progress from the stigma side. From the Dawnwood Institute, then, we went on to develop Bellwood Health Services, which was a joint public-private relationship with the Ministry of Health in Ontario. And eventually the Dawnwood was merged with some other centers, but the Bellwood does continue. I retired a number of years ago, but was pleased over the years because, as was said, the problems and the addictions and the drugs keep changing. And so your program has to be flexible. The other thing is that it has to be holistic. So I'm so pleased that Dr. Anthony is involved and Melissa's involved because we often forget that part. And there's often medical problems underlying that if you don't have a medical person involved, you're never going to find out for the individual. So you look at treatment over the years. We did research and evaluation on our programs, and we were able to test them and see that they made a huge difference from a success point of view and from the recovery of individuals and cost savings to business and industry and the province.
When you look at your experience over the years and everything you just mentioned, but you look at where we are now with addictions. People talk about the opioid epidemic in Canada, other issues. Where do we need to go to make more progress with this now? What are your thoughts on what needs to be done to stop the epidemic, to make progress in treatment for folks and to move forward?
Well, if I had the opportunity, and I'm past posted now, but really I think the biggest thing is to be able to be open to many options and to realize that most governments have silos that work independently from one another. And when you're dealing with a serious health problem like addiction, regardless of what it is, people need the medical care we talked about. Some people need housing. Some people need long-term housing. Some people need retraining. Some people can go home because they live in the suburbs. the key is to have a network of services that can help and come together with barrier-free. So we're not just referring to an outside counselor or referring to a detox. We are facilitating that process. We start wherever the person shows up, whether it's Emerge, whether it's the church, whether it's with a medical crisis because of a fight or a broken arm, anywhere you can intervene to try and engage them in a process that will lead them to better health. And then, as the doctor said, some people may not be ready for full-scale treatment. Others might be, or they might be if they just have some support for a while. But the key is it's not just an acute problem of detox. It's a chronic health problem like heart disease, cancer, diabetes. It needs to be case managed over a long period of time. When you look at cancer, and if you have people going for treatment for cancer and they're cancer-free for 5 years, they talk about them being cured. So you're not going to be looking at treating addiction and being successful if you're only treating them for a month. You need to have the support network, and that's what I like about Vida Nova, is that they have thought about that right from the beginning. And they're building a team there with a concept that is going to support people and put the necessary network around them. They could really be helped at a provincial and a municipal level if the barriers came down between housing and retraining and funding and referral times, that type of thing. And the doctor said, having to wait for treatment when a person has a glimmer of motivation, that window was very small. You need to be able to do something immediately. And we don't have that system. The one group that I'm really impressed with is a place called Turning Point in Richmond, BC. They have worked with a variety of different agencies on a municipal, nonprofit, and provincial government basis to pull the continuum together so that it's not just one organization, it's a series of organizations collaborating to probably deal with the most serious public health problem we still have today.
Linda Bell, thank you for taking time to come on the show and to lay all that out for us. I think the context there, everything you said, it's important for people to hear, for understanding from someone like yourself. I appreciate you taking the time.
My pleasure, Adam. Anytime.
Linda Bell there, co-founded and served as Chief Executive Officer at Bellwood Health Services. Folks, you're listening to The Signal today on the show. We're talking about sustainable recovery, right, from addictions, what it takes to get there, what works, what's needed afterwards. My guests in the studio here are all from Vida Nova, the province's newest addiction center. Right, we've got Ryan Kirby, co-founder, Melissa Wells, managing director, Dr. Anthony Parrell, medical director. Folks, thoughts on what we just heard. I saw you you're nodding, right? We had some nods around the table, but what are your thoughts on what you just heard?
I've been chatting with Linda and receiving support from her as we've been developing our programs.
Quite the resource.
She's been amazing.
Yeah.
She's provided wonderful feedback and wonderful support and resources. And she's validated the thought and the premise of our entire model of holistic, evidence-based care that will start with the medical detox, move through the treatment, and the longevity of it, following up with people and supporting them after they're done their treatment in whatever way that individual requires. It very much needs to be individualized, a treatment plan. So it's, not one size doesn't fit all when we're talking about recovery. So it's very important to keep that open mind about how it looks for each individual. And Linda's been able to support us as we're developing our programs and that theory through our programming.
Your thoughts on it?
It was a very interesting perspective, and I agree very much with what Linda was saying of needing to meet the patient where they are and then being able to see them through. Because in my training, I was taught that unfortunately addiction is characterized by relapse. So I want to with this team, be able to catch people in those hard situations to hopefully prevent those things down the line.
Yeah.
And meet them where they are. Because, some people will be clear of their substance and just need help to stay off of it. There's, we're going to treat them with the counseling piece, the peer support, medication adjuncts, anti-craving meds, those sorts of things. And then there's the people that are acutely in the depths of substance use, where it would actually be lethal for them to stop immediately. Like one of the more lethal ones actually is alcohol, because you can have DTs and seizures. And, I've had people come to me in emerge situations who just decided to quit one day and didn't tell anyone. And then they show up to the emerge and I'm intubating them because all the medications we have to stop the seizures and everything it's not working because it's gotten so far. The goal is to meet them where they are, follow them through. And then once they're out of Vida Nova, keep them connected, keep them following up.
Yeah, supports, right, afterwards. Like once they're out back home, like what's home on day one, right? Mm-hmm. How does that work? How are the meals happening? How's the laundry happening? How are you showing up for your appointments? Then how does week 1 turn to week 2, month 1, month 2, and the supports needed to stay healthy and to hopefully thrive?
Yeah. Absolutely. And when you think about it, discharge planning needs to start from the beginning, right? You need to consider that goal at the end when you first come into treatment. So we will have a collaborative team, an interdisciplinary team to help support that client get to that place. And some people are going to need extended programming. Some people are going to need a sober living situation. It's going to be different for everybody. But knowing that the staff of Vida Nova, there's some people who don't have that support when they're ready to leave. There's lucky people out there who have the support. And I know Ryan talks a lot about him being that lucky person that had a support system when he was going through his journey of recovery. But there's some people who don't. So Vida Nova will be your support. We will continue that support throughout your recovery. We will be checking in, we'll be following up, making sure that you have the supports in place and you're going to your meetings. And then Dr. Parrell will be that medical support as they move along through their journey.
Well, Ryan, talk about how did we get to Vida Nova itself, right? I mean, talk to us a bit about your journey, if you're okay with that.
Yeah, no, I certainly am. Vida Nova was born around a table, but, it's something that's been on my mind for a number of years. And, I've been out of treatment now for almost 7 years.
Congratulations.
No, thank you. I really appreciate it. It's pretty cool to be able to say. I'm very proud of it. Yeah, for sure. It's been a journey for me. And, to be coming up on 7 years and to be sat here now talking to you about the potential of opening a facility that can help not just people of this province, but around the country and around the world. It's incredible. Yeah, she talks about, Melissa just talked about supports, and I wouldn't be where I am today without my supports. That I can tell you right now. I will just say quickly, my
speaking of supports, this is kind of big.
One of my biggest supports in my life is my brother Michael, and he was fortunate enough last night at 10 p.m. Newfoundland time to reach the summit of Mount Everest.
Mount Everest.
Mount Everest.
Not a small mountain.
No. Tad bit taller, I think, than we see around here.
No shade on Gross Morn, but this is a bit of it's a bit more of a jaunt.
Yeah, you know what? He has worked his butt off the last number of years training and meticulously planning everything out. He's very meticulous in everything that he does. He sets his mind to something and he does it. I'm incredibly proud to call him my big brother. He's my hero. Yeah. And, when I struggled, he was one of the first people right there. When I said I needed help and we talk about this small window, I had people just pick me up and grab me and say, let's go. Yeah. And so I'm so fortunate and lucky to have those supports. My partner, Aaron, who supports me every day in everything I do and is a big part of helping get Vida Nova opened. I'm just so lucky and fortunate. So, and that's, Vida Nova grew. Basically, this is happening because, it started because I struggled.
Yeah.
And, in being like real, I don't know that we would be here today doing this if I didn't struggle. We probably would have, maybe that property up there would be something else because it wouldn't have been as prevalent, like as in the forefront of my mind of something to do. So when I look at that, it's a good thing I did struggle. What I went through, it happened for a reason. And we're here today now, and with the potential of helping hundreds and hundreds of people, however many that is. And if I needed to struggle for that to happen, then hey, there's nothing wrong with it. Yeah. We're here to help. And it's amazing the type of person that you will see come out of recovery, that's someone that really goes at it. These are very powerful people who, have tools that a lot of normal people will never have. And so, it's incredible, man. I'm very, very, very fortunate and lucky, and really hope that, we get to open our doors very soon and show people.
Do we know ish? I know you don't know exactly.
No, well, I'm very optimistic that the doors are going to be open the beginning or middle of July.
Okay, July.
Yeah,
okay.
So we're getting very close.
Man,
all our flooring just arrived. The walls are getting painted. The sprinkler system was just installed. We're getting very, very close to opening.
All right. Yeah, no, that is all progress. Right?
Yeah,
like,
for sure.
Sprinkler systems are in. Hey, like this is moving in the right direction.
Very close, yeah.
Tell us, we've got a friend of yours, Dr. Andrew Smith, who, you guys played soccer together growing up?
We did, man. We grew up together, Andrew and myself, playing soccer, which is something that it was a big passion of mine my entire life. And, when Vida Nova, when this started to become real, and we made our first post, I guess maybe 4 or 5 months ago, one of the first people to reach out to me was Andrew to congratulate me. Couldn't believe what we were doing, and offered support in any way that that he could help. He's an incredibly smart person who has his own story that I'm sure he'll probably want to share with you guys if we
got him on the line now. Dr. Smith, Andrew, how you doing?
Hello. Hi. I'm good.
Hey, thanks for coming on the show. Much appreciated. Tell us a bit more about yourself.
Sure. So I just so happen to be a psychiatrist, but I think the more interesting thing about me in the context of this conversation is that I'm an addict and an alcoholic who is in recovery myself. And that's one of the reasons why I was so excited about Ryan's project, and why I reached out to him when I heard about it, is because, this is an issue that I deal with professionally all the time, but also one that I have an intimate familiarity with personally.
If you don't mind me asking, how long? What was the process for you to enter recovery? Like, how long did that take, and what was the work like around it?
How long did it take? So it's. I think we've heard already about how relapse is a part of recovery, and so my journey wasn't
straight line.
Wasn't a straight line up Everest. That's for sure.
Yeah.
It was a bumpy road, and so that started just after my dad passed away, and it lasted until probably about a year after I got out of rehab. I went to rehab in Guelph. It was a process. It was a learning experience, and it was a struggle for sure. One of the things I wanted to, I know this is, you're trying to get my story, and here I am already going off track.
That's okay.
That's the way it is. Ryan mentioned how struggle can be a good thing, and things happen for a reason. And I say all the time that almost ruining my entire life, almost taking my own life inadvertently, was actually probably the best thing that could have ever happened to me.
Yeah. And what happened after? Like, when you say it was for the best thing to ever happen to you, what have you built after this? Where are you? And just tell folks about what you've achieved and where you are personally.
Yeah. So I'm over 7 years sober. I have a great position. I just recently stepped down as the medical director of inpatient psychiatry at the Ottawa General Hospital. I'm a clinician investigator at the Ottawa Hospital Research Institute. I also have a whole bunch of other sort of side projects that I do. People can look me up on LinkedIn if they wish. I think I have an Instagram account now. I'm not sure.
You got to post pictures in order for it to be an account, Doc.
I'm an old guy, I got a team that's helped me out running these kind of things. But yeah, so like when I say that it's the best thing that ever happened to me, what I mean is, it forced me to address some of the vulnerabilities that I have that I wouldn't have been forced to address otherwise. It made me a more complete and more empathetic person, and a way better psychiatrist, because I can sit with someone who is struggling, and while I may not have struggled in the exact way that they have, I know what it's like to struggle. I know what it's like to overcome something difficult and to have to change your life. And that's not something that I would wish upon anyone else, but it was an incredibly valuable experience for me in my career and in my life.
So then, for your intersections, right, as a psychiatrist, as someone in recovery, when you look at what is happening across the country when it comes to addictions, what are your thoughts on where we are and where we should be headed for making progress?
Yeah. Big question.
Yeah, oh yeah. No, we could do a whole other show.
Yeah, addiction has always been a big issue. It certainly seems to be becoming bigger every day. I always come back to this saying that I really love, which is that the opposite of addiction is connection. And I think that a lot of what we're seeing these days is directly related to that. That people are disconnected. People feel disenfranchised. There's a lot of poverty, a lot of homelessness, and those are huge problems that I don't necessarily have solutions to. Obviously, if I did, yeah. I'd be working on that already. Where we're headed, I think that what Ryan and his team are doing is a step in the right direction. It's not the solution, but it's a part of the solution.
Yeah. I keep thinking, Dr. Smith, Andrew, about, like you mentioned that, recovery, it's not a straight line. And I think that for folks listening who it's themselves or family members, I think it's such an important point to remember and understand on people's paths to wellness about, lots can happen. And like you said, it's not up and down Everest. It is, there's detours here and that's part of the process.
Yeah, absolutely. That's part of life. You set goals and you have setbacks. And things aren't black and white. It's about trying your best, and it's also, I think, a big part of recovery is understanding that relapse is a part of it, but relapse is also there is something to be learned from a relapse. And if your recovery is just relapse after relapse, and you're not learning anything or changing anything or developing, then I would argue that isn't really recovery. And so relapse is a part of it, but it also matters what you do with that. What do you take from it? What do you learn?
Ryan, do you want to jump in? Just say hi to your friend.
No, Andrew, thank you so much for coming on here and, sharing and being so vulnerable, man. I know it's not easy. And, I can't thank you enough. The information and stuff that you've shared with us has been invaluable. And I can't wait for you to get home and see us around opening day, man. I'd love to see you.
Yeah. It's my pleasure to be here, and I'm glad to hear that the sprinkler system's in.
Yes, it's been a big topic for sure.
Dr. Andrew Smith, thank you for coming on the show. I appreciate you talking about yourself like that, because it matters. So thanks so much.
My pleasure.
All right, thanks, bud. All right, on the line from Ottawa there, Dr. Andrew Smith. You're listening to The Signal. Today we're talking about sustainable recovery, right? We're talking about Vida Nova. Could be as soon as July. It will open its doors. Here with me, you're just listening to Ryan Kirby, co-owner of Vida Nova Recovery. Melissa Wells is here, managing director. We've got Dr. Anthony Parrell here, medical director. And folks, as you're listening, if you have thoughts for us, if you've got, or a question or two as well, if there's something that's in your mind and you want to communicate with us, the text line is open, 709-327-8206. Emails thesignal@cbc.ca. Once things open up, what are the numbers again for what we're expecting, for what you're expecting for treatment, for helping folks? What's the ambition?
So we have the ability to open up 54 beds throughout the facility. So that will include medical detox, the beds for inpatient treatment, as well as the cottages that we will be able to offer different type of support for extended programming or sober living. It will be unique, as we continue to say, based on the individual and their needs. Mm-hmm. But we will be able to support a significant number of residents of Newfoundland, Labrador who are currently on wait lists and who are currently maybe not seeking treatment because they know there's a wait list or they know that there is a lack of resources.
And where the exact location? Where exactly is it? I don't know if I covered that. I was just like, I don't know if I talked about that.
Yeah, no. So it's immediately off the Salmoneer line.
Yeah.
It's next to it used to be the old Lavrock site owned by the Anglican Church. So it's on 32 acres of absolutely beautiful property. We have 1 kilometer of waterfront. We have 4 or 5 beautiful hiking trails right on our property. And so, it feels like you're in the middle of nowhere, and we're 30 minutes from town. So, resources are very close. We're very close to the town of Holyrood, which we plan to work with as much as we can. And, like location is absolutely stunning, but yet the location is just one aspect of it. The location gives us the opportunity to really hone in on the holistic side of things and what we do there in being able to connect with nature, sunrises, sunsets, all these things, meditation, yoga, breathing, music. Nutrition. We have a mental health and addictions nutritionist who's going to be on staff to help our clients learn how to cook meals and teach them, just to give them the daily skills for when they leave, because to be able to integrate back into society.
And if you can't talk about this, I get it. But in terms of if folks are looking for treatment, right? Is it an insurance? Like, so there's obviously payment or insurance, or like what's the range for what, like, or even what you hope to achieve with everything?
The hope is to be able to accept everyone. Yeah. We're trying to work right now with the government to secure a contract to be able to accept anyone with MCP. Yeah. That is the goal, the ultimate goal. And I mean, we'll be, that's what we want to happen. So, and we've been talking with the government a lot and hoping that we'll have a positive outcome there. Then, you also have your insurance, private pay, and different nature like that you can certainly avail of. So, but the goal here is to work with the government and be able to help as many people as possible.
Right, because right now you talked about the what's available here in the province, and then there is that bit of you get some folks who do have to go up to places like Bellwood and other things, which, I mean, like cost alone there is massive. Plus, you're away from home,
away from family, to travel, having to get on a plane by yourself maybe in one of the most vulnerable times of your life. Things of this nature, to have a facility now that, if you get a call and you want help, we can go pick you up in our car. We can go pick you up and get you right up on site,
What's the... So, news broke, right, that you're doing this. I'm assuming you're getting a call or two.
Yes. Yes, I get emails and calls every single day.
I would think that, Melissa was inundated when she first started. We forward her everything from our, from our Facebook page and our website. Mark and I were keeping up on just trying to respond to people that we will. The second we get someone hired that we can, who knows what's going on here, we'll be sure. And so she's been incredible in reaching out to everyone. I mean, Adam, it's heartbreaking. I know Mark, my partner, would say the same thing, but I wake up every morning to just random inbox messages on my messenger for
you must be even just your own Facebook.
Oh no, I'm sure people just find me on Facebook and just message me and say I need help. My son, daughter, my uncle, my aunt, and not being opened it's absolutely heartbreaking and. Just getting our doors open so these people, we can get the process started of getting people on their journey. Yeah, it's huge.
What types of messages are you seeing, Melissa?
I'm seeing messages from, like Ryan said, from people reaching out for themselves, struggling with drug abuse and alcohol abuse. I'm hearing from mothers, I'm hearing from fathers, aunts and uncles, friends. Most of the messages have the same sentiment. This is an incredible person who has so much to bring to the world, but they've been, covering their problems with drugs, and now they're too deep, and now they can't get out. We need your help.
Right. What are your thoughts on that, Dr. Parrell?
Well, I just wanted to thank Dr. Collins for his thoughts and telling his story. His example. Oh, sorry, one second.
The cough button's there for a reason, my friend. And good usage of it. We tutored you before the show. He's so good.
So his story kind of exemplifies what I see in practice, which is addiction can hit anyone in any stage of life. There's addiction that you see in society, but there's also the addiction that you don't see. And thank you, Dr. Collins, because there's an extra layer of stigma within healthcare of saying that you're struggling and you needed to get help. And I'm really thankful for you having the time to come on the show. But yeah, I'm very thankful that this will be another resource to people here to get help. Yeah.
Why did you go into this?
I went into this because I saw what a person at the other end can come out as.
Yeah.
Because my training really taught me that this was a disease like any other disease, and it's very treatable as well, and gives a lot of hope and can save lives very rapidly. And I saw addiction in every layer of my training, from people struggling and coming into clinics demanding opioids and things like that, to overdoses and suicidal attempts and everything in the emerge, to you're in a clinic and here's a gentleman in a suit who's back to work and his life is back and his kids are back, and I was very inspired because that's the person, and the disease is what they're struggling with, and we can help them with that disease.
Yeah, seeing that right, the after in recovery, special.
And then I also saw, unfortunately, stigma against people who struggled with addictions, like people who were on methadone for 10 years and stable and their life is back, and then they're still treated like they're a lesser person.
Yeah, like there's something wrong with them is how they get treated, which is not the case. Yeah.
When I don't stigmatize people for having diabetes or any other medical condition.
Yeah. Melissa, what about yourself? Like what brought, like as you entered into this field, what kept you there and kept you going along? And then because you mentioned earlier a little bit, but tell me a little bit more.
So as I said, the majority of my career was in mental health and addictions, and I developed a passion for supporting the vulnerable population. And just with a little bit of research, you can see the lack of resources and what we need, and how many people are on wait lists, and the people that are out there who are crying for help. My inbox would tell a story, and I always knew that my career throughout the health authority, my career as a nurse, would bring me back deep within mental health and addictions, and this opportunity came to me, and I knew I needed to bring my expertise to this position to support the opening of Vida Nova. And I will, to add to that, my inbox may be full with people struggling and people crying for help, but it's equally as full of people who want to help, people who want to volunteer, people who want to come and support, help develop the programming, help. I've had people say, even if I've just got to paint a couple of walls, I want to be part of this new facility that's going to revolutionize how we provide mental health and addictions care in Newfoundland and Labrador. So it's just as much, there's just as many people out there who want to support this, and it's very invigorating. It really, really inspires everybody to keep going and to keep working towards the ultimate goal.
We had a caller who, and this is to recap something that was already mentioned. A caller asked about if it's covered by MCP. The conversations are ongoing on that, so folks, the announcements will follow with these conversations. So that will, I know we'll be covering it, right, like for CBC. So just stay tuned, like in the coming weeks and months, to see how progress is made there. So that's the answer to that question. We had an email come in from Gary. He says, I did have a drinking problem years ago. I finally got off the bottle and have an excellent life now. What I spent on alcohol is now spent on books, music, and my pets. So
love it.
Incredible. Wow.
Thanks for that. Often time comment
thanks,
on
Gary.
the show. And I'm looking at the press release you folks sent out too, right? The province, what we've talked about, critical shortage of inpatient addiction treatment services, only 29 beds available across the region. Recent data reveals a 56.3% increase in demand over the past 3 years, highlighting a shortfall of more than 400 beds to adequately serve. So now this is, once open, it's a step towards that number, right? And driving that number down. What have the discussions been like around? Because I again, look, thank you for sending me your PowerPoint slides on info. I noticed a lot of partners and people you've been talking to. What were the conversations like in the beginning, whether it's the provincial government or others, and how do you go from conversation one to where you are now around this? Like, what's that process like in getting folks on board with what you're doing?
I mean, to be honest, it's very easy.
Wow.
When we tell people what
Yeah,
we're
yeah.
doing, it's like, whoa, how can we do it? How can we do
Wow.
it? How can I get involved? So from everyone in Holyrood, like different businesses in that regard, but then agencies, when we talk about, like, we can talk about Veterans Affairs and different groups who are, very supportive of what we're doing and hoping that, they have the ability to send clients to us. Yeah, man, it's been a crazy 2 years at the end, and to be sat around the table here now discussing final steps of how this is going to look and the potential impact it can have on the province. It is a small step, 55 beds is not, we could use, like they said, we could use a lot more, and the two facilities now, they're 28-day programs, they could be longer, so the ability for us to do 6, 8, 10-week programs and even then continue on longer than that with aftercare.
Big difference. Yeah.
Oh,
that's such a, there's a lot to that with like 6, 10, like up to 10 weeks plus aftercare. Like, for everything we've talked about, I think people can have an idea of why that can be so important.
So important.
recovery.
I think about it from even my own perspective in that. You're a week in treatment when you're using before you go. You're a week just figuring out, just getting a bit of sleep and, trying to figure out your brain and all these things. So, and then for a 4-week program, you only got 3 weeks left to dive into a ton of things. And one thing that Linda had mentioned is about the underlying cause. And, 95, I would say, % of people that struggle with drugs and alcohol have an underlying condition there, and a lot of it is the reason why they're drinking, leads to the reason why that's happening. So to have a team like this who were able to figure out what that is, that underlying cause, because if we don't figure that out, there's a pretty good chance that regardless of how many weeks with us, you're still probably going to end up back where you were without figuring out what that was.
Let's get you to a point where we can look at it and try to start figuring out, like, okay, what's going on here, which is causing some of this, which is contributing to it, or an intersection with it. So then we can figure out, like you said in the beginning, right? Case by case basis. Each person's going to be different. So unpacking each person to help them on a path of recovery takes a whole lot of time, effort, thought, and like you say, that holistic approach, which is so needed.
Yeah, and it needs to be very much trauma informed, like Ryan said.
And what does that mean, by the way? I've talked about it on the show before, but I always it's all, like, I think it's important for folks to understand what trauma informed means.
Yeah, so it's really just doing that root cause analysis of what is going on with the client and what trauma they may have endured in their life to bring them to where they are. And it's really using those evidence-based practices around trauma-informed care and ensuring that you're tapping into the trauma, because it's that, like I said, it's that root cause. And if we don't look at that root cause of what's gone on with each individual person, you're almost just putting a Band-Aid on something, right? So all the research will show you, and every conversation that I've had with people with lived experience and clinicians across the province, the highlight is really make sure you do that root cause analysis and you focus on that trauma that is unique to that particular individual.
And and things don't all come down to money. This will make sense in a second when I get through what I'm about to say here. But I looked at, again, a stat: annual economic cost of mental health and addictions related issues in Canada, $51 billion, right, nationally across the country. When you have someone who gets the help they need and is on a path to recovery, and then that starts getting stacked. What does that mean on the other end, or like for that dollar figure when we think of other health supports, criminal justice, everything else? Can someone explain that?
So I can speak a little bit to that.
Yes, please, doctor.
And another thing I was thinking about that inspired me into this work was actually seeing too many people die.
Yeah.
Or have major complications, brain death, all things we want to avoid from overdoses and toxidromes and things like that. And it's pennies on the dollar that you're saving the whole society with good treatment. So these treatments can be very effective. And an example I'll give from my own personal experience, I had a poor patient. She struggled with heroin and came in an overdose. And then the initial provider treated her, and then I came on shift, and then, she went out somewhere else and into like a bathroom and injected again, and then overdosed again, and then saw me, and then I'm treating her again. And then she, I think, made it out to the parking lot, injected again, and then came back another third overdose. And the numbers we're talking about for emergency care, resuscitation, costing the system that amount of money is thousands, unfortunately, when the pills are pennies to dollars, and very effective. And that's only if someone wants opioid agonist therapy, for example. I just use that as an example because I've heard, for example, with Suboxone studies saying, a number needed to treat of 2. So every second patient you treat is going to get back to society with that.
Right. All of that, right? Because we're talking people and care and getting them back to being able to live lives, right? And also for communities and money and everything else. Like, I mean, there's a lot to it. Like, it's a complicated thing.
Yeah, for sure. I mean, then they're back into society, but then, we're becoming productive members. We're getting paychecks, then we're paying taxes, that we weren't before.
And back to families, right? And being with families.
Back to families, back to loved ones, That's exactly right. Connected back with the community. And that person that's back connected with the community is one strong individual. It's, it's pretty incredible.
Well, and then you get maybe to the point they're doing the peer-to-peer support that we were talking about earlier in the show.
Right? It's that cycle, right? And then you've got that person with that lived experience that can bring that into the community of drug addiction to support people as they're moving through their own journey. It's incredible.
Is what you're doing scalable?
Yeah.
Yeah.
100%. Yeah, we think so. I mean, I think that we're going to be able to show here, like, just as, we're trying to track, like right now in our renovations and everything we're doing, we're trying to track where our money is going so that we can show that something like this is very viable in another part of the province. So, with all the money that we inject into Holyrood, we can show that we can do this in Grand Falls, or we could do this in Corner Brook, or, you know what I mean? And then we could also look at the sober living side of things, and we can put some different places around the province so that as a client leaves Vida Nova, they have an outlet closer than having to come all the way to us to,
There's more there.
More there.
Yep.
Final thoughts for today as we're about to be done for everything. What do you want to leave us with? What's your final thought? Who wants to go first? We'll go to the doctor because why not? Dr. Parrell, what are your final thoughts?
My final thoughts are me thinking about our mission statement, which would be like, this is giving up one thing for everything, and I really think Vita can help the province take another step towards recovery. Nurse
Wells, final thoughts.
Thank you. I'm very excited to be part of this team and this endeavor to I've said it before, and I love this word, revolutionize the treatment that we're going to be able to provide to the people of Newfoundland and Labrador, and certainly across Canada. I think that we have a very established, evidence-based program on paper and ready to go and ready to provide this opportunity to the people of our province. And I look forward to moving forward and certainly hopefully coming back again to discuss our progress and as we move forward.
Ryan Kirby, the sprinkler system is there, so
that's what I wanted to talk about in my final comment here. So I'm not really sure. No, you know what, Adam? I'm really proud to be able to introduce everyone to Melissa and Dr. Parrell here today. Yeah. It's a big step in Vida Nova to be able for people to meet them and to understand. We're very serious about what we're doing here. We are opening in the next 2 months, so people look out and reach out. I really, really appreciate you taking the time to talk to us today. We really appreciate it.
I've been wanting to have one of these conversations for a while on the treatment side, so I'm just super happy you're all in to have this chat and we can continue it. So thank you very much.
This was great. Thank you.
All
right, folks. Thank you. That is it for today's show, everyone. Victoria Day weekend is here, and with it, the kickoff to many summerish outdoor activities, camping, fishing, ATVing. We're talking about that tomorrow. If you're heading camping, tell us about it. We're going for a hike, a trail run, secret fishing spot. Call us tomorrow. It's a Victoria Day weekend show. We're talking about safety and the outdoors. Thanks again, folks.